Hello, it's Bob Pandolfo, and I just want to have a quick video about something that could help people avoid a heart attack, maybe even a stroke. I wanted to make this video for a while. I had my heart attack 10 months ago in March of 2023 when I was 68 years old. And one of the things that I wanted to mention is that it's pretty tricky to know if you're having a heart attack right away because it's not always pain. Like in my particular case, I wasn't in pain. I had a feeling of heat, actually. So what happened is earlier in the week, I had this feeling, like women sometimes talk about hot flashes, and it kind of felt like that. And it lasted about 5 minutes, and I thought, that doesn't feel good. It went away. I thought I'll go to the doctor next week. Well, 2 days later, it came on again, and it kept getting worse. We called 911. They rushed me to the hospital. They did an angioplasty where they blew out the clot, the blood clot. They went through my wrist, and it was over very quickly. And then I felt fine. Now what happened? So what happened was, as this heat, this hot flash feeling came on, it started to feel like pressure after a while in my chest, but there was no pain. Some people say they get a sharp pain, they get a pain in their arm or something. I didn't get any of that. So that's the thing. Like if something feels bad, you probably should go to the doctor, right? And earlier in the week it felt bad for like 5 minutes, and I said, well, I'll go to the doctor next week. Now, so just be really careful about that. Now, as far as cholesterol and statins and everything, I had been trying to avoid a statin. I have my own reasons for that, which I don't want to go into, but I thought, well, I'm going to give it one more chance to bring my cholesterol down. And I had tried, at one time taking a combination of the omega-3 pills and red rice pills, which are supposed to lower your cholesterol. That didn't do anything. So I thought, all right, I'm going to try one more time. I looked at videos on YouTube. There's a lot of cardiologists, on here. And I said, what can you eat to lower your LDL, your bad cholesterol? So I wrote down about 10 or 12 different things that are supposed to be good for that. And every day I ate 5 or 6 of them. 4 months later, I had the heart attack, but a week later, when I came for my follow-up, with the cardiologist, I said, gee, I guess all these things I was eating that was supposed to lower my LDL didn't lower it. And he said, no, they did actually. And I'll show you. Here's my cholesterol in October of 2022. I had my lipid panel. It was 282, and my LDL was 193. When I had my heart attack in March, which was only like, now I didn't start eating these things in November. I started in like middle of December. That's when I said, I got to get serious about this. So basically in 4 months of eating, 5 or 6 of these things a day, and I'll mention some of them, my cholesterol dropped from 282 to 214, and my LDL dropped 49 points from 193 to 144. These aren't really bad levels. I mean, years ago they wouldn't even put you on a statin with this kind of a number. But they were borderline high. And actually here it was very high. So I said to the doctor, I said, geez, I thought it was coming down, and but I still got the heart attack, and we both kind of agreed. Well, maybe if you had started that a year earlier, you wouldn't have gotten the heart attack, But in 4 months though, just eating things. Now here, what was I eating? I was having olive oil almost every day with a salad or something, avocados, walnuts, oatmeal, a lot of beans. I made something called a cowboy caviar salad, which has like 3 different types of beans in it. You mix all different things in it, corn and olive oil, and it's actually very tasty. So every day, arugula was another one. Anything with whole grains. So every day I ate 5 or 6 of these things. And after 4 months, the cholesterol dropped sharply from 282 to 214. And a big drop in LDL, but I got the heart attack. So the thing is though too, and this is another reason why I wanted to make this video. I think one of my mistakes through this whole thing, besides, I could have, first of all, I could have gone on a low dose statin. I mean, that may have avoided the heart attack right there. Because you really don't, with these cholesterol numbers I had, a low dose statin probably would have gotten the numbers down. But another thing too is, I was just talking to my regular doctor, my MD. You could go if you have insurance. You could go to a cardiologist. You don't have to have a heart attack first to go to a cardiologist. In fact, my son's doctor said to him, "Why don't you go to a cardiologist?" When he was, worried about his cholesterol. And so now, if you go to a cardiologist, there's all these different things that you can check. Like, for instance, you can have, besides your lipid panel, because your lipid panel is going to go over your LDL and your HDL and your triglycerides. But besides that, you can do a calcium scan, right? A calcium scan is where they actually look to see, if you have calcified plaque. Now, it's a little tricky because, a lot of young people, it'll show 0 or a very low number like 0. But that doesn't mean they don't have any plaque. It just means that it's not calcified. So in other words, the plaque isn't dangerous yet. But still, if you go in for a calcium scan and it shows that you have calcium, calcified plaque, and the number is pretty high, you should be on drugs. Basically, I mean that. And again, I'm not a doctor or anything, but this is basically the research that I did. But at least at that point, like if you have high calcified number on that scan, that you're at high risk. You know what I mean? So that's one test. Another test is this apoB, and here on verywellhealth.com they talk a little bit about it. It's basically, some people say it's more accurate blood test than the lipid panel. It's a protein in LDL that transports cholesterol. So, here this particular doctor said it's usually not covered by insurance, but it's inexpensive. And some people say, like this in this particular article, they say they think it's actually more accurate. So if you have a bad apoB rating, that means that you have a higher risk for heart attack. So, and this is something, the reason why I mentioned cardiologists is because, your doctor is most likely not going to say anything about apoB. All right, it wasn't even around. It wasn't even a test they were testing 4 years ago. And they also, he's probably not going to say anything about his calcium scan. You know what I mean? So this is the thing, it's a lot of people go into the doctor and all the doctor says, "Oh yeah, your cholesterol's gotten high, I'll put you on statin." But I mean, there are other things you can do to find out a little more, a better idea of what that cholesterol is doing to your body. Is it calcifying? You can check that with a scan. Do you have a high apoB? If you have a high apoB rating, then again, that means that score, the LDL score and your total cholesterol score, that gives you a better way to accurately look at that and say, hey, what's my real risk here? And the thing is too is that they're going to put you on a statin or any other kind of drug. Give them, you'll have a better way of analyzing what dose you should go on. So, and you have to keep in mind too, and this is another reason why I'm doing this. High cholesterol can give you a heart attack or a stroke. Here's types of stroke. There's 2 types. The most common is ischemic stroke, which is caused by a blockage of blood flow. The risk factors for this type of stroke, including high cholesterol, are the same as heart disease, right? Now, the other type of stroke, the hemorrhagic, I don't know how to pronounce it, is different. That's a ruptured of a blood vessel. But this stroke, which is the most common, is it's the same risk factors. High cholesterol can cause that, and of course these things can be, not only can it kill you, but they can completely screw up your life. Obviously, if you get a bad stroke, you can be paralyzed or something. So, again, this is the reason why I wanted to make this, because I'm sure there's a lot of people out there like myself who are reluctant to go on a statin, and I should have done more research. Not only looking at reading articles like this or watching YouTube videos by cardiologists, but also just telling my doctor, let me talk to a cardiologist. Why not talk to a specialist if you're concerned, especially when you get up in age. When I was 68 years old, my cholesterol was 214, and it had been 283, before I started eating all that extra fiber and, olive oil and stuff. So, just you gotta be careful with this stuff. I mean, and I don't want to push drugs on people, but maybe going on a low dose statin in the long run, could keep you from having one of these episodes, And the thing is too, if you do more research on this, part of all this is inflammation. Inflammation kind of gets into your plaque and hardens it, and that contributes to the calcification, which is what's dangerous. Everybody has plaque basically, but if it gets calcified, and that's when it becomes dangerous. And then the inflammation is a factor, according to a lot of these cardiologists and these specialists. And some people say, again, cardiologists, some of them say, that, and I've seen, by the way, I've seen, studies on this. They say that inflammation comes down somewhat with the statin. So it doesn't just lower your LDL and your cholesterol, it lowers your inflammation marker. So these are all things, again, these are things you have to consider. And naturally, that are there side effects of statins? Sure. But the thing is, with me, my case, being that I put off taking the statin, I could have taken a low dose. I end up now on 4 drugs. So now my cholesterol, you could see how quickly my cholesterol dropped from March till May. In like 5 weeks later, I took my cholesterol check again after I went on statins. And my cholesterol dropped from 214 to 132, and my LDL dropped to like 67. So what happened was then the doctor, already twice my cardiologist has lowered my statin. I started 80 milligrams, went to 40 milligrams, now I'm at 20 milligrams. And then they give you a blood thinner when you have a heart attack. He also lowered that already. And then they give you another drug, a low dose of another drug that is basically helps your blood from forming blood clots. And those 2 drugs, the blood thinner and the one that will help you protect from getting a blood clot, they put that in because of the stents. They put 2 stents, in me, and those they will phase you off normally. So 6 months to a year, So in March, they may take me off those 2 drugs, and then I do the baby aspirin a few times a week, pretty much every day, 35 milligram baby aspirin. I don't know if they were going to have me stay on that or not. It may end up I'm just be on statin and baby aspirin, or just a statin, but I'll find that out in March. But again, that's it. Like now I'll put some links. I'll mention some of these things on the bottom. The apoB, the calcium scan, and again, you got to take this stuff seriously. I exercise every day, right? And I was 10 pounds overweight when I got my heart attack. So you can't, and I don't smoke, not a heavy drinker or anything. So, you can't just say, oh, I'm in great shape, I'm going to be fine. These numbers do mean something. In my case, my doctor told me when my cholesterol was 282, you should go on a statin, and I didn't. I was like, no, I'm going to try one more time, and, I'll get it down with diet and exercise. So now what I did, this is the last thing I'm going to say, when you get a heart attack, they do follow-up EKGs to test how your heart is pumping blood. They call it the ejection fraction. Now mine was 55 before my heart attack. I knew that because when I had COVID, I was in the hospital for a couple of days and they tested it. It went down to 45 after my heart attack. So it's supposed to be between 50 and 70. So I was kind of lucky because 45 wasn't that bad. So there wasn't a lot of damage to my heart from what they tell me. Now they said to build that up, do more cardio. I was, kind of inconsistent with cardio. Some days I would do like 5 minutes of cardio, and then I would work out with weights for like 15 minutes. Now I do 15, 20 minutes of cardio a day, even in the winter. And during the summer, I was riding my bike almost every day for, 20, 25 minutes. And my ejection fraction went from 45 to 62 in like 3 months. And 62 is really good, especially now I'm 69 years old. So the cardio, did help. I mean, cardio is good for your heart. It's and it's funny too, because 3 weeks after I had the heart attack, they gave me a stress test, and they said you can exercise all you want. You can You can push your heart rate up to 130, 140, even 150, right? So I was like, yeah, I'm not going to do that, not right now. I mean, because 3 weeks after you have a heart attack, you're still in that anxious kind of zone. You know, there's anxiety. You know, you get kind of a PTSD. But I did, you know, after like 6 weeks or so, I was riding my bike and, you know, for, you know, 3, 4 miles and working out with weights every day. So, you know, because at that point my heart felt fine. I didn't feel any kind of twinge or anything, you know, and my anxiety was over. And it's a good thing I did that, because that's how you get your heart flowing again. You get your blood flow up again, which is what you want. So anyway, again, I just wanted to do this because, you know, something, you know, don't fool around with this stuff. You know, go to a specialist, get the test you need. You know, be aware of what's out there, what's available, the tests that are available, and you know, make wise decisions. You know, because these are the type of things that just boom, and you know, it could not only end your life quickly, but it could, you know, ruin your life where you're still alive, but you got a stroke or something, and you know, you can't, you know, you're paralyzed or something like that. So anyway, this is Bob Pandolfo. Subscribe to my channel. Thanks a lot for listening, and best of luck to you, and best of health.